Good morning to you all. First of all, I wish to thank our National Institute of Siddha and Central Council for Research in Siddha, Director General, for organizing this Strength of Siddha Medicine for Communicable Disease as a national conference. And also for inviting me to be the participant of this grand conference. So once again, I thank NIST Director and as well as our Kanavuli Madam for giving me this valuable opportunity to deliver this address before such a national level conference. Government of Tamil Nadu is taking keen interest in promoting all traditional medicines, all traditional treatments for the people of Tamil Nadu, especially during the COVID, which is a communicable disease. We have taken very, very great efforts in containing the disease as our Government of Tamil Nadu department. Our Honorable Chief Minister of Tamil Nadu, in the second wave, he has readily came and he has inaugurated our exclusive Siddha COVID Care Center in Chennai, and also instructed all our doctors, our staff members to start numerous centers all over Tamil Nadu for the treatment of this COVID-19. So based on our Honorable Chief Minister advice, we have started all centers of COVID treatment centers, Siddha centers, in all district headquarters, even in Taluk headquarters also. So totally the number started around 85, including all centers, and based on our centers, more than 40,000 COVID patients, they have been treated very nicely and they have completely cured and they went to their house. So such a work Government of Tamil Nadu is doing. And in the same way, I also wish to thank our Honorable Chief Minister and our Honorable Minister for Health for announcing a Siddha University for our Tamil Nadu, and which is have been announced in the Assembly, and it will be going to start in a very recent, within a month or so, by our Honorable Chief Minister. Actually, on behalf of Siddha fraternity, I wish to thank our Honorable Chief Minister of Tamil Nadu for this valuable gift to our Siddha doctors. Actually, when the university comes, definitely, although now we are going on a scientific guidelines, scientific way our treatment is being given, when the Siddha University is being installed, definitely it will be a milestone in our Siddha fraternity, and further research will be taking place so that all international queries and international queries will be answered in this. Actually, we have decided to have a Directorate of Research in that Siddha University so that all our treatments, all our approach to the patient are scientifically monitored and scientifically we have researched in every aspect of our Siddha doings. So actually, once again, I wish to thank our NIST Director and CSR. And during the pandemic also, we have learnt a lot of lessons. Since COVID-19 is a communicable disease, so our doctors in Tamil Nadu, especially our Siddha doctors, they have responded in a very highly spirited way. Actually, even in the first wave, when our Government of Tamil Nadu, they instructed immediately the doctors has to take their positions and they have to treat the patient. And during that time, we don't know what is there with the virus, what is going to be, how it is going to be affecting the frontline workers and all. But actually, our Siddha doctors, more in all over Tamil Nadu, including the private practitioners, they have volunteered for the service, and then they have treated many patients, even though taking a huge risk. And during the first wave, even we don't have vaccination also. So even in that time, so they have responded, they have put their PPE kit, so they were with the patient and they were always inside the patient hall only. So I have seen in many pictures and even in many of the online programs we have conducted, web seminars we have conducted, and many doctors, they were with the patient at that time. So once again, I thank the Siddha fraternity for readily responding to this kind of pandemic, and they to give their full service to the people of Tamil Nadu. So now we have decided, as per government norms, now all communicable disease also will be scientifically researched by our department. So we have a good team of scientific workers here. So that's why two colleges, Palayangotai and Chennai, are functioning. Apart from this, there are 8 colleges of private oriented, and they are also imparting this Siddha system of education. So in all aspects, now the focus should be on the scientific research. So once all our findings, all our manuscripts have been scientifically analyzed and given to the public, definitely it will be a milestone in our Siddha development for the help of public people. As per our department is concerned, so we have more than 1,500 dispensaries all over Tamil Nadu, which is manned by our Siddha department. Siddha doctors are there. So further, in every year, government will be trying to focus on the public-oriented programs. For example, during this flood, in this flood situation, our Honorable Health Minister, he has instructed, because our Siddha doctors, they work in the field. He has instructed to organize thousands of camps all over Tamil Nadu in anticipation of the dengue. So this camp has been now being continued now. I also thank the doctors who have dedicated themselves for those camps. So it has been highly proved that for dengue, our Nilavembu Kudinir was an excellent choice of defense, and many scientific papers have come out. So in this situation, the COVID-19, dengue, in other communicable disease also, we have to concentrate. Actually, now the Ayurveda system and Siddha system and all Indian system of medicines, they have stabilized in non-communicable diseases. For example, in sugar, diabetics, in BP and all. Now people once, this is my practical experience, the initial stages of the diabetic, the initial stages of the BP, now most of the patients, suddenly instead of plunging into allopathy system, which is has its own side effect, now the public are moving towards Indian system of medicine, either Siddha or Ayurveda. And in the initial system, initial stage itself, so when they are following both physical as well as some sort of medicines available in Indian system, so definitely further progression is controlled. This has been scientifically proved, and many papers are there. In the same way, this communicable disease also, our forefathers, the Siddhas, they have encountered a lot of communicable disease. Because in the early days, the humans, there were a lot of interactions with the wild species only. Even COVID-19, they are telling it is being transmitted from pangolin, from fruit bats. In the same way, in early days, 2000 years, time immemorial, 1000 years before and all, our forefathers, everybody, they will be having close interaction with the animals, which is, since COVID also, a zoonotic disease. Most of the communicable disease, the origin is only zoonotic nature. So that time itself, they have standardized the type of treatments. So our treatment, it is purely not based on this completely double-blinded randomized design. Our Siddhas, so they have tested in many patients, so their whole, in the Siddha research, no, in the early days, it will not be come like this. Within 3 months, you start a research and put a randomized double-blind design, and within 3 or 4 months, you will have a result here nowadays. But during that times, the ancient days, many manuscripts telling that they researched for hundreds of years. Many hundreds, many centuries they researched one disease. Then they finally concluded this kind of herb or this kind of medicine, alchemy, they have prepared in that medicine. This cures this fever. So it is the time-tested one. Actually, time immemorial, they have given some medicines, and then finally they have standardized that. And then these all our Siddha medicines, Ayurveda medicines, the mostly they are time tested. So people can believe that definitely this medicine will have effect on the particular disease. So even when even I am not a Siddha doctor, so my background is in genetics and plant breeding, a biotechnology aspect. So I approach in the sense of scientific nature only. So I have seen the fever classification in Siddha, just they have shown me when the pandemic came. Actually, they have classified, our Siddhas, they have classified all symptoms in a scientific way only. All fever system, symptoms, everything, it was scientifically arranged, and each type of fevers, they have given a treatment, they have given a type of medicines. So, people are believing that something they are giving, Indian system, they don't have scientific proof. So that I totally disagree. And all systems like Siddha, Ayurveda, all natural Indian system of medicine, they are all time tested and they are scientifically proven to that point of time. So now what we have to tell, these kind of findings and all, we have to analyze scientifically, we have to go scientifically, and we have to prove that our system is a scientific origin. So in this pandemic also, I find the Siddha system has published more number of papers than any other system. So that I have seen personally, and many doctors, young doctors, they have a scientific approach towards the treatment, everything. So in this sense, so now this coming 2 days, lot of people based on the experiences, many of them will be sharing COVID experiences, dengue experiences and all. So I wish them that they, these kind of knowledges are not only shared and aired in this auditorium, and our Directorate of Indian Medicine, so we can compile all these things. By Nalam, we have very good infrastructure there. We have money also for that. We have around corpus fund is also there. This national conference papers, so we will try to make into a book from our department, so that it will be given to all libraries and it will be used for the future people also. So once again, I thank the Kanagulli and his director for organizing such a good conference. These are all only initial stages. We are at the preliminary stage of research. So there is very, very long way to go. Actually, many doesn't know that. So even in Malaysia, for orthopedic department, they are asking all Siddha doctors to be part of that. So the Varmam Sikichai, it is giving a very immense 100% result. So once the orthopedic surgeon have completed his procedure and all, the final touch, Siddha doctors, they need the Siddha doctors, and many doctors, I have discussed with them what is happening in other countries. So not only Malaysia, it should spread to all other countries. Many places, our valuable this science has to be decimated. So for that only these kind of conferences, and with the Siddha University, definitely we will take a lead. For example, we have decided to have a Directorate of Research in our Siddha University. So and that Directorate will take care of all our research activities. So once again, in this very good occasion, I wish to thank our Honorable Chief Minister of Tamil Nadu, and I wish to thank our Honorable Health and Family Welfare Minister of Tamil Nadu for providing us a Siddha University for our further future development for the system. So, and once again, I thank you all the participants who have come all the way from many places. Thank you all of you. Thank you.